Scientist who co-discovered Ebola has been telling CCTV about the ethics of using an experimental drug to treat the disease. He also suggests that more funding and research be focused on the development of vaccines. CCTV's James Chau sat down with Piot.
This Ebola outbreak is the largest and the longest that we've ever known. It came a bit as a surprise when in '76 we investigated with our team the first known Ebola outbreak. It was very localized, and all outbreaks since then have been, sometimes serious with a few hundred people who died, but always local.
Not only national health systems are struggling, the international charity Médecins Sans Frontières says it can only do what it can do. What do you think is likely to happen next if more cracks appear in the global response?
What we need now is a major concerted effort of the international community to support the local authorities, the local governments, the local NGOs, because the solution can only come from within. And that solution is not so easy. What we're witnessing in West Africa is a perfect storm. We do have such an unprecedented, vast epidemic of Ebola hemorrhagic fever because these countries are coming out of decades of civil war, Liberia and Sierra Leone, resulting in dysfunctional health systems, poor health services and public services, a lack of trust in authorities. Fortunately, all this is changing now in the sense that the countries have declared the epidemic as a public health emergency following a decision by the World Health Organization. Now, developing, but it's still not at the level that it's needed.
You call for infected patients to be given immediate access to experimental drugs, none of which have been fully approved yet. Do you think this will expose them to higher risk?
When you think of a disease that has up to 90% fatality rate, compassionate use of experimental drugs is absolutely justified ethically, and that was confirmed by the World Health Organization. But secondly, we need to make sure that this is the last outbreak of Ebola where all we have is isolation, quarantine, and some supportive care. We need to make sure that we have stockpiles of effective therapies, of vaccines, when the next outbreak will come, because there will be a next outbreak. The virus is hiding somewhere in nature, some animal, probably some fruit-eating bat, and Central Africa up to now has been affected multiple times. This is the 25th known outbreak, and there will probably be more in West Africa. The populations there are growing, people are more mobile and are more in contact with the forest and wherever the virus is hiding.
How far off are we from a vaccine for Ebola that's accessible to all?
We'll have to test them and evaluate them when there's the next epidemic, because the only way to find out whether a vaccine works is to test it in humans, and for that we'll need the next epidemic and be ready. But the good news is that thanks to this epidemic of unprecedented proportions in West Africa, there is a renewed interest in funding research in terms of treatment and of vaccines. My worry was always that once the crisis is over, that people think, okay, we go back to normal, they forget about it. This is not a huge health problem in most parts of the world, so there's no market incentive. So there's a need for public funders and charities to come in.
There's talk now of perhaps a travel ban. There's been cancelled international flights. There have been quarantines around entire towns and villages. Do you worry that this current outbreak of Ebola will leave a legacy where the people of West Africa are isolated by this disease, people who are already detached by poverty, by hunger, by violence?
The impact of this epidemic will go way beyond the number of people who died and the damage to families and so on, because there will be orphans left. There's economic damage. We need to restore the trust and we have to rebuild the health services. But I think that the canceling air travel, for example, that doesn't make sense to me in terms of trying to control the epidemic and make things worse. Because how to provide international assistance if you can't get there, isolating the countries is not going to control this epidemic. In some cases, quarantine of parts of a country can be justified as long as we make sure that economic activity can continue as well as it can, that people have food and that basic services are provided. Otherwise, the quarantine won't work, and then, again, it will make things worse.